So in terms of introductions, I'm Kim Saxton. I'm the faculty coordinator. I am also teach marketing, and I'll teach one of the classes that we will have in this certificate. We also have Johanna Rohler on the phone, and she is about to be an alumna, so I'm going to refer to her that way. But she was a dietitian by training, and through our Evening MBA program has moved into more of a brand management position. And we also have Associate Dean Phil Powell, who is an economist by training, and who will also be teaching one of the courses in the program. So we wanted to get you exposed to students and to faculty members that'll be part of this program. So I'm going to let Johanna start, and this is a quote from a blog post story that Johanna put together with our marketing team, talk about the importance of business training in healthcare and her dietitian role. So Johanna, go ahead and share some of the things that you learned as you joined the Evening MBA program and were exposed to the training from Kelley.
Yeah, absolutely. So I think that there's a lot that I have taken away from the Evening MBA program that is really adding to the depth and the breadth of my understanding. I think that taking business classes just gives you a completely different framework to think about problems through and also do problem solving. When you're a clinician, you really think about how you can identify your patient's issues and then how you can best address those. And then with business, it's much more having a vision and then how you can bring that vision to life. And so it's just different ways of thinking. And when you can bring those two together and you can really understand how to just the nuances of patient care and then also combine that with an understanding of the ecosystem of healthcare and all the different levers that drive that industry, the different interests, stakeholders, and challenges that industry is facing, it really puts you in a much more powerful position to be able to affect real change.
So as you started in the Evening MBA program, what were, what things did you discover that surprised you but that you liked?
Yeah, so I think that when I started the MBA program, I knew I wanted to be a leader, but I didn't really understand what I didn't know. And so the Evening MBA program has done such a good job of exposing me to all of this information that I didn't even know I needed to know. Everything from accounting to finance to healthcare operations management. Each one of those classes has really given me valuable information and really important tools to take with me to work. When I started the program, I was working as a clinical dietitian in a hospital, and the combination of my clinical understanding with my business classes and understanding, the importance of patient satisfaction and reimbursement and just how you can help leverage your patient care to really not just help your patient's well-being, but honestly to really help the well-being of the overall organization. It helped me really execute a couple projects that had really big impact and were even recognized as regional best practice within the organization.
That's awesome. We love to hear those kind of stories. But what trepidation or fears did you have going in, and how did you wrestle with those?
Yeah, so I remember after the first week of classes, thinking, wow, what have I gotten myself into? I don't think I'm going to have much free time for a while. And I remember just, really thinking about it again and, wondering if I had made the right decision. But I also knew that I wanted to be challenged and that doing something hard would really be a transformative thing for me. And that's exactly what happened. I think that, there's a couple different values you get out of a program like this. One is what you learn in the classroom. And then the other part of it is how you learn how to balance the program with everything else that's going on in your life, and how you can be a really strong time manager, and how you can, really have the grit and the tenacity to get through everything that you have to get done. Because it's not easy, but being a leader and having a lot of responsibility isn't easy either. And you have to be able to prioritize and triage your time really, really well.
Yeah, I think that's an important point. And for our potential students, that's one of the reasons for the graduate certificate in medical management, we've downscaled some of the requirements at the beginning. So in the Evening MBA program, Johanna was taking 2 classes full-time and working full-time. And in this program, you're only going to be taking 1 class at a time in order to make it a more manageable transition to the business learning. So Navpreet and Sherry, do either of you have any questions for Johanna? And then if not, we're going to let Johanna go so that she can get to her class and not make her late to somebody else's class.
Can you hear me?
Yeah.
Oh, good. This is Sherry. I think this is the first time I've done Zoom conferencing. So I'm figuring it out. I'm a physician assistant and I work in surgery. I was at St. Vincent for 18 years in general surgery, and I'm now at St. Francis in surgical oncology. But, just being in medicine, I think I agree with what Johanna said. There are so many things you see that could be done more efficiently, or you just want the skills to, exactly like what she said, help your organization run better. So that's why I was looking at the program, and it sounds like a really neat opportunity.
Great. Well, I'm glad you figured Zoom out. We're all figuring Zoom out. It seems like every day we're figuring something new out. And I think you did pretty well for your first time.
Thanks. Thank you.
Do you have any specific questions that Johanna could address? Or I think we love your comments, but I just wanted to make sure you had an opportunity to ask a student.
Johanna, you're in the MBA programs, and this will be, again, the first year that you're doing the certificate program. Is that
right?
Correct?
And the biggest difference, you'll have the same faculty teaching the same level of rigor, but we've moved around the classes. I'll talk about the classes a little bit more to make them more manageable as an kind of an onboarding ramp to business. And also, you'll only take 1 class at a time. In the Evening MBA program, they take 2 classes at a time. So they finish the program faster, but then the workload is a lot higher.
Will it be? Will this be something where it'll be kind of a stepping stone? You think most people will then go for their MBA, or is this a degree on its own that you think will be sufficient for people to have most of the information they need to really help with the business side of their practice?
So our goal is to have people who have more business savvy that are able to have an impact in their organizations. And we do think that some people, once they get exposed to it, will want to know more. And so we think some percentage of people will move on to the Evening MBA, but we've structured it so that you would have a solid foundation about on the core business concepts. And I'll show you what the courses look like in just a minute, so that it could be a standalone training.
And I'll have to, just so you know, I'll have to jump off. I'm sitting outside. My son's getting ready to start a baseball game, so I won't be able to say too much.
All right.
But I'll email you with any other questions I have.
Well, we'll record this and I'll send the recording out. And so you can also take another look at that as we go. So I'm glad you had a chance to ask Johanna. Navpreet, do you have any questions for Johanna? If not, I'm going to let Johanna go and I'll just try and get through the rest of this as quickly as we can. I'm going to take silence. Go ahead.
There we go. So, Joanne, are you currently full-time working along with taking classes, or how are you managing your certificate now classes?
So I am working full-time, and then I'm taking classes in the evening. And you can, in the Evening MBA program, really plan out how many classes you feel like you can manage at a time and take it at the pace you feel most comfortable with.
And in this program, you'll only have 1 class, and I'll show you that we know already all of the nights that you need to be on campus for the year.
Mm-hmm. Okay.
So your whole schedule is already planned for you.
Already planned. And that's going to probably take 2 whole year, 2 semesters?
So when the Evening MBA program, they finished the entire program in 2 years. And this is a year-long certificate program. And then if you wanted to move into the Evening MBA program, you would probably finish in another year and a half. And you would be cutting about 2.5 quarters off. And I'll show you how that works in just a minute.
Okay. Yeah,
okay.
That would be my next questions. And you'll probably require you'll need my transcripts to see how many credits hours I have so far and all that to be able to qualify.
Yep, I'll walk you through all that in just a minute. So if you have any other questions for Johanna, now's a good time to ask them. Otherwise, we'll let Johanna go and we'll get you through the administrative details of this program and as in the rest of the slides.
No, I'm good. Thank you, Joanne, for your time.
Awesome.
Thank you.
Yeah, good luck, everybody. Nice to meet you.
Have a good class.
Bye.
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 All right, so I'm not going to spend a lot of time. You guys are already here, so you have some ideas about why health business training might be important for healthcare professionals. And I think Johanna did a really good job of sharing her perspective on that. You may or may not know much about Kelley. Are either of you very familiar with Kelley? But just to let you know why we're involved in this, in addition to being a top-ranked school, and we have faculty who are doing research in this area. We have faculty who are acknowledged experts in teaching. We've been working with working professionals like yourselves for the last, 15 years, 20 years. We have an MD MBA program. We have a physician MBA program. And then we also have a Center for the Business of Life Sciences. So we've been highly involved in healthcare as well as business and the intersection of healthcare and business. And then in terms of our sort of objective measures, we are, I said, a top-ranked business school. We have the #1 online MBA program with Kelley Direct. Our part-time evening program that we've talked about is number 9 in the country and number 1 for academic quality. And this certificate is part of that evening MBA program. And then we also have the full-time MBA program down in Bloomington, which you can see also scores really well in terms of teaching quality and student satisfaction. And those are all important parameters for us. We like to be researching teachers. So the way this program is designed, it's for working healthcare professionals. So you have 5 courses to complete in 1 year, 1 per quarter. And then the 5th class, you'll take overlapping between the spring and the summer. So you'll start with the leadership, which includes conflict resolution and negotiation. You'll do value creation, which is a combination of microeconomics, accounting, and finance. Patient experience is the class I teach, and that is a combination of marketing and operations. And then in the summer, you'll have strategy and innovation with Associate Dean Phil Powell, who's going to tell us a little bit about his philosophy in a couple of minutes. The class will be 70% online and 30% live. And so you will have classes every other Thursday from 6 to 8:40. And I'll show you those dates in just a minute. So we know that they're every other Thursday. Classes are 12 weeks long. So you'll meet each class meets 6 times. And like I said, you can schedule the whole year because we have it on the website. We do expect that you'll have to spend 5 to 7 hours a week preparing for class and participating in class through weekly assignments. Some of those will be quizzes. There might be some online discussions. Might be some team exercises that you have to do. It's all managed electronically through a learning management system that we use called Canvas. And there might be some online sessions through Zoom. And then every other Thursday, you'll have a live session where we try to bring all the ideas together and give you a chance to practice them in a hands-on way.
Okay.
Here are the courses, and here are all of the in-class sessions scheduled out for the whole year. We've looked at the holidays and tried to minimize what happens at the holidays in order to make it work. And then the 5th class is the capstone experience. It's going to be a consulting project that you do supervised by me, and that'll kind of kick off in the spring, but really most of the work will take place in the summer while you're working on the strategy and innovation course with Phil Powell.
Okay.
So, Phil, you want to tell us a little bit about what you're planning for the strategy and innovation course and just your general philosophy about this program?
Absolutely. Can you hear me? Thanks, Kim.
Yeah.
Awesome. Navpreet and Sherry, great for you to join us, and whoever's listening to the recording. I've been working with Kim. Kim and I worked a long time here at the Kelley School. We've both taught in the Physician MBA program. And about a year ago, we started thinking that we need to bring the same spirit of what we're teaching our physicians to a broader audience in healthcare. And we're just real excited to launch this. So I have the pleasure of teaching the strategy and innovation class. When we think of this program, it's really about bringing folks taking this certificate. We want them to come out on the other side of the certificate leading change in healthcare. And that's why the curriculum is very much grounded in practical application, along with some foundational knowledge, theoretical knowledge that you're learning throughout the courses. To me, we've got a healthcare system that needs fixing. And clinicians and those who support clinicians have to lead that charge. And the problem with hospitals and hospital systems is that they've had to sort of adapt to a very dysfunctional, larger national healthcare system. And so we've got to sort of unlearn what we think is good business in healthcare, which is not, and we have to relearn it. And so when you look at what is taught in the courses, in the value creation course, in the course that Kim teaches, in the leadership course, we're setting this foundation so that everyone who comes out of the clinic, the certificate program, can go in and really lead high-level positive change. And it's not just about innovation. Innovation is about doing things better. It's about disruptive innovation. We have to positively disrupt healthcare. What we think of as normal in healthcare is really bad in a lot of ways, especially from a management perspective. So we want to sort of equip all of our certificate students to go in and disrupt in a positive way. What that means is that's innovation, that's change that accomplishes 4 things at one time. It accomplishes better clinical outcomes for patients, lower costs, higher patient satisfaction, and just as important, an elevation in staff morale. For clinicians right now in healthcare, there's a lot of burnout. There's a lot of frustration. For folks that are 10, 15, 20 years into their career, even 5 years, they're learning, oh my gosh, I got into healthcare practice to help the patient. And the system does everything in its power to prevent me from doing that. And so we come at this certificate philosophically and almost as a movement to go in and change healthcare. And so if we come back to my course, Healthcare and Innovation, or Strategy and Innovation, what this course is sort of caps off the academic part of the 4-course sequence to give you that mindset of how do you go into an organization? How do you communicate a vision of change? How do you map that out? How do you build coalitions to move that change forward? And then how do you get the whole organization or your team to move forward to implement those kind of changes? Changes that when people look back, they're going to go, wow, this is a great improvement. And so this course embeds itself in newer theories of strategic thinking, design thinking, and how do you lead? How do you sort of change the world in a big organization? And it's an exciting. You consume some exciting new ideas of how to take yourself to the frontiers of change. And we look at cases of healthcare systems and clinical environments where we've seen successful change, and those successful stories inspire what you can accomplish when you get out of the certificate program. So very, very exciting stuff.
That's nice.
Thank you, Phil. Do you guys have any specific questions for Phil?
I do not.
I don't think so at this time. I may have to get running here, but Kim, can I call you with other questions if they come up?
Absolutely. I'll send you the link.
Deadline again for the application?
Well, we would love to have people apply by August 1st. The classes will start September 3rd. But, this is the first year, so we will probably be a little bit loose on that. But for sure, one of the things that we have right now is we can waive your application fee for the month of July.
Okay.
I can send you the discount code. When we email, I can make sure you get the discount code. So we're trying to encourage everyone to get in by August 1st.
Do you have many applicants so far?
Yes, we have a number, and we're at the same time excited and a little bit worried. We want to make sure we don't have too many people in the program.
Okay. How many do you plan on taking?
So we would probably cap it at a max of 40.
Okay.
And we're not there yet, but we are certainly making progress.
Yes, you got another month. Okay.
Yeah.
That sounds great. Thank you so much for your time, and I will
Thank you, Sherry.
Okay, you have a wonderful evening. Okay.
All right. Thanks, Sherry. So one of the questions I was asked is, how does this work with the Evening MBA program? So I want to make sure I put that into context, which is the Evening MBA program consists of 18 classes. And so for someone who wanted to take this program, these certificate classes, these 5 classes would count as 5 of those 18, and you'd have to complete the other 13. So it's just about a third of the program.
Okay.
And the Evening MBA program is divided into core classes and elective classes. There's a total of 5 elective classes, and this certificate would function as 3 of those 5 elective classes. And then 2 of these courses would be core courses, so that you would be able to, apply it into the required courses, not just the elective courses.
I see. Okay.
Yeah. Our admission requirements, we have to write an essay and have a letter of recommendation and things like that, so that, it is a rigorous program. So we have to make sure we have qualified students involved in it. You have to have a bachelor's degree and at least 2 years experience. And we're looking for a GPA over 3.0 for your undergraduate. But again, we're going to look at the whole person. There is no graduate entrance exam, for example, so you don't have to take the GMAT or the GRE.
Okay.
And I should have updated this. This is our current, our previous cost estimate was for over $800 a credit hour, but we recently got approved for $700 a credit hour. So this total cost is now $10,500 for tuition.
Okay.
And then there are other university fees that, of course, have to be covered. And then you have to cover your textbooks, parking, and those kinds of things. And we have submitted our applications for CME accreditation and financial aid, and we expect to have those approved and in place before classes start in September.
Okay.
The application process itself, it's on the website. You apply to IUPUI, to the graduate school, and then you apply to Kelley. Then we have an essay, your resume, your transcript, and a letter of reference. And all the links are there. You can see that most things get emailed to Susan Cobble. I'm going to show you in just a minute, and she puts your file together. But we do have the 2 applications are electronic, and you have to do them through the website.
Okay.
And this is Susan Cobble, who's the director, who will answer all the emails at Kelley MedCert and help you work through the process. And I'm here as the coordinator to answer questions and make sure that we understand what your needs are and how we can best address them.
Okay.
And then we have been talking with the local employers as well. So from IU Health, Michelle Janey, some people may or may not know, came from an associate degree in nursing, all the way up to the chief nursing executive and now the COO. And IU Health is a big proponent of adding business education into their healthcare professionals. Likewise, St. Vincent and Community and St. Francis, we've had really positive and Hancock. We've had really positive conversations that the healthcare organizations themselves are big proponents of their clinicians getting more business training as well. And then we've also been working with the physician assistant program at IUPUI, and they also are very excited about the intersection of clinical practice with business acumen. Phil, do you want to add anything?
No, Preet, it's glad you could make it. To everybody who's listened to the recording, we're real excited. Central the Indianapolis region is a leader in healthcare and life sciences. Our nurses and physician assistants and nurse practitioners and those who support the clinical environment, even in the back office, are part of this revolution that has to take place in healthcare. And the Kelley School sees this as a very important part of that kind of change that sits along the great program we have for physicians that's been in place for about 5 years. So it's just a real exciting time for the Kelley School right now, and there's lots of opportunity out there to improve the healthcare system. At the end of the day, this is about improving patient lives and even saving patient lives.
Well said, Phil. Well said. All right. Well, with that, I think we're going to end the meeting. And again, feel free to reach out with questions to me. Here's my email address, mksaxton@iu.edu. I think I probably emailed everybody at least once. So I'm that bothersome person who's really just here to help you transform your career and have an impact on healthcare.